The Doherty Institute is providing the National Cabinet with the modelling that underpins Australia's reopening roadmap. It's confident that 70 to 80% vaccination will be good enough, but it says people have to accept that zero COVID is not viable long term. Professor Sharon Lewin is the Doherty Institute's director. Sharon Lewin, you put out the statement yesterday to say that the 70 to 80% mark will be okay and that it doesn't matter what the actual number of cases is in the community at that point, as long as we continue to use some kind of safeguards at certain times, masks, social distancing and so forth. Why is it that the case numbers won't make it that much of a difference at that point?
The reason is that once the original modelling was done with a seeding event of 30 cases that grew over time, and its growth is limited by the percentage of people vaccinated, so different if it's 70% or 80%. The capabilities to test, trace, quarantine and isolate would still remain really important in the response, even at 70% to 80%. That's a really important concept. It's not just the vaccination, it's vaccination plus public health and some public health measures. So those numbers are going to grow. If you just have limited test, trace, isolate capacity, you will reach 400,000 cases. If you start at in the tens, it takes a few weeks to get there. If you start in the hundreds, you just get there quicker. The trajectory is much the same. Now, one very important point to make, though, is when you open up with hundreds of cases, or hopefully not thousands of cases, your test, trace, isolate capabilities are further stretched. You can do a much better job when you start with fewer cases.
So if I'm understanding correctly what you're saying as well, what people have to wrap their heads around at 70 to 80% is you're still going to have to isolate if you've checked in somewhere and you've found to have been in the vicinity of a COVID case. You'll probably have to wear masks in some settings. There'll still be social distancing. If we want it to work, everyone's going to have to keep following certain protocols. It's
an absolutely key part of the model. The short answer is there is no freedom day here. 70% or 80% vaccination, we will have more freedoms. There's no doubt about that, and that's in the model there. But we will still have public health measures. We will still need to test, trace, isolate. We'll still need to follow cases, actually, to do the job of test, trace, isolate. And at different times, there might need to be limited lockdowns, but will be much less frequent.
Is it possible that Australia would ever get to 90% vaccination?
I'm actually pretty optimistic about Australia's capacity to get really high levels of vaccination. What worries me more is whether we get equal vaccination across all sectors of our society, so that we want to, 70 to 80% means 70 to 80% vaccination in First Nations people, in cold communities, in remote communities, in low-income suburbs. That's what we want to see. I'm pretty optimistic because generally vaccination uptake in this country is good. These vaccines work really well, and so far the uptake's looking really good once we've got a significant supply.
There were some figures circulating today claiming 90% vaccinations needed in Australia before opening up. Otherwise, there will be 25,000 deaths. Now, that would be more deaths than many countries, including Canada, Pakistan, Portugal, have had in the entire pandemic, even pre-vaccination. Can you see any scenario in Australia where deaths could reach that kind of a level?
Deaths could reach that level if we have absolutely no public health measures. So if you just say we're just going to rely on vaccination and we're going to let things open and we're not going to do anything else and have our Freedom Day, all of the models, there's a lot of models out there now, they all pretty much say the same thing. There's minor differences, of course, but they say the same thing, that vaccination alone, even at 70 to 80%, will be insufficient to stop our healthcare system being overwhelmed and stop the deaths that we don't want to see. And that modelling that you're referencing assumes that. It's saying it adds some other important things to the model, but it assumes that there isn't this additional layer of public health measures, which I think we've all got used to in Australia, and we actually do surprisingly well. And, we've grown used to it. We'll need to live with it.
Is there any place in the world with open borders, freedom of movements for its citizens, high vaccination and zero COVID? Is it an achievable goal based on current evidence anywhere around the world?
Some countries are close. Taiwan is close, but it has intermittent, significant public health measures and probably not open borders. Parts of China have done well. They don't certainly have open borders and have very long, prolonged quarantine and very significant lockdowns. I think we should look to countries that are doing well, such as Singapore, Iceland, Hong Kong. They're the sorts of countries we'd like to emulate that could live with a manageable amount of COVID and very high vaccination rates.
Sharon Lewin, thanks for your time.
Pleasure. Thanks a lot, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.